Well, millions more Americans can now get COVID booster shots after the CDC gave the green light late last night.
Right. How soon can you go get them depends a lot on a lot of different things. ABC 27 senior investigator Kendra Nichols walks us through it all.
Some places in the Midstate are already offering the booster. The other big news is now you don't have to stick with the same brand.
I think boosters are important, especially for people who are older, to prevent severe disease, but for all of us to prevent breakthrough infections which can drive the pandemic.
Dr. John Goldman is an infectious disease specialist with UPMC Pinnacle Health. We asked him about the CDC saying it's safe to mix shots.
There appears to be no increase in side effects, reactions, if you get a second dose of a third dose of a different vaccine.
Right.
Obviously, we'll get more data, particularly on whether or not this works better by mixing and matching, but there really doesn't appear to be any danger to that.
Important to note, there are still restrictions on who can get the booster right now. For Moderna or Pfizer, you must be 6 months past your second vaccination dose and either be 65 and older, in a long-term care facility, have underlying medical conditions, or work or live in high-risk settings. If you received the single-shot Johnson & Johnson vaccine, a booster is recommended for everyone at least 2 months after their vaccination because the J&J vaccine hasn't proven to be quite as protective. Where can you find it here in the Midstate? Penn State Health says it will be ready to give Moderna boosters immediately once the CDC issues formal guidance. WellSpan Health says scheduling could open as soon as Monday. CVS says Moderna boosters are available at more than 9,800 locations starting today. Rite Aid tells us Moderna boosters would be immediately available. Johnson & Johnson booster doses will be available at select stores depending on supply. Wegmans, Giant, and Weis markets are also ready to offer booster shots, but some require scheduling an appointment first. We could learn more about shots for kids next week. An FDA panel is expected to discuss it. Of course, the CDC will have the final say. With the ABC 27 investigators, I'm Kendra Nichols.